A really important part of good ergonomics to a healing back is something we call the perfect stance. So you thought standing was super easy, right? Well, there's a perfect way to do it and not so perfect way. First off, your weight should be evenly distributed. So you're not leaning. Most people lean, right? And we don't want to lean. That puts abnormal stress on the joints. The next thing we want are our knees and hips slightly flexed. Now, if you unhinge the knee, not bend it, but if you unhinge it a little bit, nobody can even tell that it's bent. So it's just a little subtle thing that takes the pressure off the joints and puts them into the muscles where they belong. The next thing we're going to learn how to do is engage 3 important core muscles for standing. One are your transverse abdominals. You simply pull your tummy towards your spine, just like that. And just that takes some practice. You know you're doing it right if you can talk and do it at the same time. If you're doing that and you can't talk, that's your diaphragm, your breathing muscle, not your transverse abdominals. That's an important back stabilizer. The next one we're going to do is we're going to look at our knees here and we're going to squeeze our hips up here, almost like there's a $100 bill in your backside, right? And you don't want it to drop. You squeeze, and look what happens to my knees. They flare out. And what that does is it engages your external rotators and supports your pelvis onto your back. And then the last one are your adductors right here. And the adductors, you engage them by simply squeezing your feet together. So if I was on ice, my feet would squeeze together. But since I'm on carpet with shoes, I'm squeezing together and nothing's happening. So I have my knees and hips are unhinged, and my knees are, or my 3 core muscles are engaged. I'm externally rotating my knees, I'm squeezing my feet together, and I'm pulling my tummy in. I'm sitting up nice and straight. That's the perfect stance.